Good afternoon, everyone, dear chairs, dear audience. Let me introduce my PhD topic titled Mobile Motion Analysis. My name is Azamat Bissenov. I'm a medical doctor from Kazakhstan. My vision, high-quality health changes behavior and the personalized medical care for disabled people. To pursue of this vision, my mission is clear: to promote widespread use of mobile motion analysis system for easier diagnosis and the more accurate treatment of musculoskeletal disorders. There are two specific goals related to my PhD topic. Today we will talk about two first. My first project is called Investigating the Validity of Inertial Measurement Unit on Gait Parameters in Ambulatory Individuals. The gait, the way of walking, is a fundamental aspect of our lives. It's not just means of getting from one place to another. It's complex motor function that involves coordination of multiple body systems. It's important for maintaining independence, mobility, and the overall quality of life. And the impairment of walking, gait, is particularly common in several diseases, such as osteoarthritis, cerebral palsy, and the stroke survivors. And the understanding and assessing of gait impairments is important for management of this disease. There is 3D motion analysis come into role. It's considered such as a gold standard for assessing gait parameters in these individuals, but usually come with higher costs and the technical complexities. In this case, there is alternative system, inertial measurement units, which usually characterized by lower cost and the ability to be used in non-hospital settings, which makes it more accessible. Because of this, my aim evaluates the validity of inertial measurement units for motion tracking. In this picture, you can clearly see this both system. 3D motion analysis system, you can clearly see it requires dedicated space equipped with specialized camera. Also, calibration process and the setup needs, it's time consuming. Also, you need expertise and clearly preparation. Lastly, relies on controlled environment. You cannot assess gait parameters in real world environment, only in specialized gait clinics. In this case, inertial measurement units, you can assess gait parameters only by using mobile phone and some sensors, and you can immediately get results also in real world environment. From this, my clinical question comes out: does inertial measurement unit have clinical acceptable validity in measuring gait parameters? In our framework, population will be ambulatory individuals, index test EAMU, reference test 3D motion analysis system, and the diagnosis of interest gait parameters. In our hypothesis, EAMU technology demonstrates comparable validity in capturing gait parameters. If our hypothesis is true, we improve accessibility for motion analysis system for a wide range of population. Our systematic search has been conducted in 4 databases, and we found approximately 15,000 hits with 4 domains. There are 3 key articles from our search, which are published in Q1 journals with same population, with same outcome, which gives me strong base for our project. After duplicate removal, we have 12,784 hits. Now we are working on title and the abstract selection. This is progress from my first project. We finished duplicate removal, we are working on title abstract selection. My second project, investigating of the efficacy of constraint-induced movement therapy for gait improvement in children with cerebral palsy. Cerebral palsy is the most common motor disability in childhood by affecting approximately 2 and 3 per 1,000 live births in the worldwide, which is characterized by a spectrum of symptoms, among which gait impairments particularly common, by affecting 97% of individuals. One is the rehabilitation approach for this patient, contrast-induced movement therapy. By restricting the use of non-affected limbs, we force the use of affected limbs. This therapy has shown promise in improving upper limb function, but its potential effectiveness in lower limb remains in area of exploration. Because of this, my aim to evaluate the effectiveness of contrast-induced movement therapy in enhanced gait parameters in children with cerebral palsy. My clinical question is straightforward. Does CIMT effectively improve gait parameters in children with cerebral palsy? Population will be children with cerebral palsy, intervention CIMT, comparison standard therapy or no intervention, outcome gait parameters. If our hypothesis is true, we improve one treatment methods for these patients. Our systematic search conducted in 3 databases. In this project, we are in the first stage still. In the summary, we are planning to finish our first project in May 2024, in the second project, September 2024. I would like to say thank you for your attention and finish my presentation. Hippocrates quote, walking is the man's best medicine. Thank you.
Great presentation. I would like to ask if comparing the EMU versus 3D motions assessment, is EMU available to assess all the parameters, all the same parameters as 3D, or there are some limitations to it?
Thank you for your question. Yes, there are some limitations, but we can predict some results by using EMU. Maybe inertial measurement units cannot assess force, ground reaction force. We can assess this only with 3D motion analysis system, but by knowing some results from EMU, we can predict this result from using acceleration in the patient's mass. We can predict this type of result.
Thank you.
Mm-hmm.
So you mentioned that your method is quite simple and it can be used by a mobile phone, right?
Mm-hmm.
How can I imagine it, how it works?
By using, you should put sensors for human body, for near the joint, some sensors, and by Bluetooth, by application, you can get immediately result in some minutes. Also, it reduces barrier for researchers and other clinicians. For 3D motion analysis, you need experienced staff to assess and evaluate gait parameters.
And can you transfer these data to some statistical analysis?
Yes, you can transfer for statistical apps only. Also for Python, you can transfer these results to evaluate the statistical result.
Great, thank you.
Great presentation, congrats. If this method is so simple, why are they not in the guidelines yet? Why are they not using this
because
method?
There are some limitations. They can assess only acceleration, angular velocity, and to find some result, you should calculate. Because of this, it's not widespread use of methods.
And regarding your second question, you want to compare your method to one standard method, or
no intervention? No intervention, maybe, because this second project is still raw.
It's under development.
Yes,
okay,
mm-hmm.
So let's not ask about it.